Alright, so shoulder internal rotation is when your shoulders are pulled in like that, and it's almost related to kyphosis of the thoracic spine, and that your shoulders are in and your back's probably hunched at that point if your shoulders are internally rotated, except you can focus more on the rotator cuff with shoulder internal rotation, whereas with the kyphosis you would focus more on those muscles that are in your back in between your shoulders right here, like your rhomboids. So some good exercises to isolate these rotator cuff muscles that are weak, and once again the pecs are tight, pulling the shoulders in, are working on the external rotation and the infraspinatus and teres minor. So first we're going to have Kelly do an external rotation. She's going to put her arm at a 90-degree angle and she's going to pull the TheraBand out like that, and that works those external rotators, which would be antagonists to the internal rotators, which would be strengthening that opposite side. So we'll have Kelly do a few of those for us. Alright, so the next one that we're going to look at, we can put the TheraBand under our feet. And we're going to lift up like that. And once again, that works those posterior shoulder muscles that need to be strengthened, that are loose and weak. So we'll have Kelly do a few of those. And we want to keep those arms straight. And pull it straight up just like that. Another one that you can do in the gym, or if you have dumbbells at home, is a dumbbell row. For that, you can get a stool like this or a lower surface, and you'll put the dumbbell in your hand and you'll bring it up like this. Once again, that works those muscles that are in the back of the shoulder, posterior end, as well as it works some of those mid-back thoracic muscles. So Kelly, I'll have you do a couple of the rowing motions. So bend over, and we'll pull up, just like that. And if it's an older patient or a patient that doesn't have access to dumbbells, they can use a soup can or any kind of household item that'll give them a little weight. Alright, we'll go ahead and stop that. And next, a common one that physical therapists use, you'll pull out at the bottom, go up, down, back in, out, up, down, back in. And that works a lot of the horizontal abductors and external rotation muscles in the back. We want our thumbs pointed upward again. That isolates those muscles that we're looking for. And all those, you can do them with a 3 sets 10 format, or modify it to the patient's need. If it's a younger athlete, 3 sets 10 works fine. If it's an older or not used to lifting type person, modify the reps, do 2 sets 10 or maybe just 15 even in some situations. Next we'll talk about some stretching stuff that we can do for shoulder internal rotation. This really, it's going to mirror a lot of what you do for the kyphosis, because again, it's that pec minor, pec major pulling those shoulders in. Also the subscapularis is pulling those shoulders in, being tight. So we can do, for this one, this is a stretch that commonly used in physical therapists. It's a wall slide. So we'll slide up the wall like that, lift off like that, get a good stretch in the chest, and come back down like that. So Kelly, I'll have you do a couple of those. So we'll slide up the wall, pull off, get a good stretch in that back, and go back in. Slide back down. Alright, another stretch that we can do for our shoulder internal rotation that's going to loosen up those anterior muscles is a corner pec stretch. So for this one, we'll keep our feet a couple feet away from the corner, hands on the sides, and then we want to lean in with our chest. We don't want to lean in with our head because that's not going to stretch anything or the right things we need to stretch. So we're going to lean in with our chest right there, open it up, and stretch out those muscles. So I'll have Kelly do this real quick. Put your feet a little bit closer. We're going to lean in with that chest, not the head, the chest. So we'll lean in with the chest. And we can do 3 of these for about 15 seconds. That'll suffice. Another stretch that we can do that'll isolate those internal rotating muscles is we can get down on our knees and find a high up surface, and we'll put our hand on it, and we're going to lean down like that until we feel a stretch right about in this area of your arm. And you can do about 3 of those and hold for 15 seconds. So, Kelly, I'll have you show them that. Alright, the massages and the releases are going to resemble the same thing as the kyphosis, because again, that kyphosis is also going to have resulted in the internal rotation of the shoulders. Again, deep tissue massages in that internal rotator area, if you move the shoulder like this and it resists a lot, that means the pec minor's tight, so you can roll the shoulders like this, then backwards like that, deep tissue massages right there, and all that's going to release that anterior muscle that's tight, that's drawing those shoulders in, that has the origins right there pulling in. So those are some strengthening stretches and massages that will help fix internal rotation of the shoulder.